Patients who see me for breast enlargement typically want to restore themselves back to the way they were before. Very often they are in their 30s or 40s, have been very happy with their size and shape of their breasts, particularly during the pregnancy, and want to get back to that same state they were before. They don't want to look obvious, they don't want to look overly round or like a footballer's wife, they want to look natural. And so the selection of the kind of operation you do very much depends on the patient's shape, their previous breast size, and also their activities. So a patient who wants to have a natural look quite often will require an anatomical or shaped implant which is less full at the upper portion and therefore doesn't create too much of a step between the chest and the breast. Patients who are very, very slim and have very little breast tissue, you want to cover the implant then, and in that case you would use the implant under the muscle. Implants come in a variety of sizes and shapes, and you'll see many patients with this very abnormal and unnatural looking result, and in order to tailor the result to the patient, I would always recommend that the patient sees a surgeon who's skilled and experienced in surgery, that they take detailed measurements of the patient, take preoperative photographs, and discuss with them, using photographs, the sort of results they're trying to achieve. The most important part of any operation is the consultation. That's the time the patient gets a chance to talk about their concerns, their desires, what they're trying to achieve, both in terms of their lifestyle and the cosmetic result, the shape. Any surgeon will discuss through the various options, the various implant options in terms of size and shape, positioning of the implant under or over the muscle, and also about the recovery period. It's very important that the patient has a discussion about any potential risks and complications. Now we know breast implant surgery by and large is very safe, but if undertaken inappropriately or by somebody who's not appropriately trained, it can have lasting side effects. So a breast enlargement operation typically takes between 1 and 2 hours, and typically in the UK is done under a general anaesthetic, although it can be done under local anaesthesia with sedation. An incision, typically about 4 to 5 centimetres, is made in the fold under the breast, and the implant is inserted. Most patients leave hospital the day following surgery and will return typically about a week to 2 weeks later on to have the dressings removed. In terms of potential issues, infection is something everybody worries about with an implant. That's why many surgeons would use antibiotics as a precaution. Fortunately, it's a very, very uncommon complication, much less than 1% in incidence. Other things patients need to know about are hardening of the implant, which can occur, and even in the long term, and that occurs in the minority of patients. The one factor that we know that can be influenced that is smoking. So patients who smoke are at slightly higher risk of capsular contracture, which is a condition where the implant hardens, and if that does happen, it will require a further operation. Patients also need to know that implants, although they are very much better quality than they were in the past, won't necessarily last forever, and they should check the details about what cover or warranty is in place with their particular surgeon. Any surgeon worth their salt will offer patients a lifelong follow-up in terms of any questions or concerns they have, and patients who are in the older category, perhaps over the age of 50, should consider having some sort of breast imaging or screening before the breast enlargement surgery. So after breast enlargement surgery, typically patients describe the feeling as being bruised or as if someone's punched them in the chest. It feels a bit sore. They'll have painkillers during the operation and also afterwards, and typically will have to wear a sports type bra which will give some support but avoid the pressure of a wire on the fresh incision. Depending on whether the implant is placed under or over the muscle, that will determine how much restriction in activity. Patients can typically return to day-to-day activities at about a week and back to work in about 2 weeks. I recommend to patients not to do anything like jogging or high exercise for about 4 to 6 weeks after surgery, just to ensure that things don't displace. Patients worry about the risks of breast implant surgery, and quite naturally so. The general issues to do with an operation under general anaesthesia, and typically one could characterise the potential risk of having a general anaesthesia similar to driving once around the M25. That's a sort of ballpark figure in terms of risk to life. It's a low risk, but one should obviously discuss it with the patient, with the surgeon and the anaesthetist. Specific risks are related to the operation itself, so obviously you have an incision and therefore a scar. And if you previously have had a pore scar, then you need to take precautions against having further pore scarring. Infection is a potential risk, but antibiotics mean that this risk is very, very low. Bleeding during the operation or shortly afterwards can be also a risk, and therefore precautions need to be taken against that. Things that can increase the risk of bleeding include certain medications, such as aspirin or blood thinning medications, and also certain herbal remedies, which is not commonly known, such as garlic. High doses of garlic can also make the blood a little bit thinner. Asymmetry following surgery, that is, the implants aren't sitting exactly symmetrically, may require further surgery, and that should be something that your surgeon would offer for you at no additional cost, if that was something that was noticed following the operation. Now, some patients have preoperative asymmetry, that is, their breasts are not symmetrical beforehand, and again, that's the sort of thing that will be discussed in a consultation and should be documented with photographs. It may well be the case that if the breasts are very asymmetrical beforehand, they may still be slightly asymmetric afterwards. It's not commonly known that probably in excess of 90% of women have some degree of asymmetry between their breasts. That is, one breast is either larger than the other, or the nipple heights may be different between the left and right side. Now, that in itself is not a problem. Say it's so common as to be normal. In some cases, however, there is a birth defect such that the asymmetry is very, very noticeable. That is, one breast barely develops at all, and the other breast develops and actually can be excessively droopy. In those cases, they can be eligible for treatment on the NHS if it's very, very marked, such that the difference in size is very noticeable. Milder degrees typically aren't eligible for treatment on the NHS, and those patients will tend to go for surgery by a private cosmetic surgeon. Options for treating breast asymmetry include using implants of slightly different sizes. There are some newer implants which are adjustable during the operation to get the size more symmetric. And occasionally one has to do an uplift on one side in order to make the nipple heights more similar, which will necessitate a little bit more scarring, but which will leave a more symmetrical result. So capsular contracture is a condition when there's hardening of the breast implant, and that may initially be just noticed by the surgeon or by the patient as some degree of asymmetry, or because of symptoms of either discomfort or hardening of the breast. If that occurs, then a further operation is required, which involves the incision being opened again, the breast implant being removed, and if the capsule is very thick, the whole capsule needs to be removed. If it's not so thick, then some surgeons would release the capsule. If the implant is still relatively new, then it's possible to replace the implant back into the same pocket, as some people do, or more commonly the implant is replaced altogether.